So a client walks in and is greeted by our receptionist. They fill out our new client form. The receptionist collects the form and grabs the client's chart. The chart is then brought over to our bin in our hallway. The receptionist places the chart in the bin and go ahead and press a button alerting our technicians that there is a room here. They then page overhead, letting the technicians know that there is a room waiting.
Exam room for Dr. Brophy, please. Exam room for Dr. Brophy.
The technician then goes and collects the chart. They shut off our light and will go and grab the patient from up front. The technician then brings the patient into a room and will go over history and vitals while utilizing our routing form. The technician, once they're done with vitals, will go into the back of our treatment. They alert the doctor that there's a room waiting for them by pressing a button and again paging over the overhead.
Yeah, they're having to like go come back and forth.
The chart is then placed in the bin. The doctor will come and grab the bin, assess the patient.
All right, let me get work on that.
Later on, the patient is then brought back to our treatment area. This is our treatment area. And our surgery suite. If a patient is being admitted into the hospital, we write their name on our whiteboard. This is our ICU.
Well, I ain't gonna look
If a patient is admitted to our hospital, we fill out an ICU treatment sheet for our ICU technician. And we also have our consent form signed from the client, authorizing treatment and resuscitative instructions. We also offer boarding. And perform x-rays. When a patient is checking out, the chart is brought up front to the receptionist. The technician will inform the receptionist that the patient will be coming up and if there's any rechecks that are needed. This is where our clients are checked out. And the technician will return to the exam room and let the clients know that it is okay to check out. And again, walk them back up to the front so they can close out their invoice.